Kia ora koutou, and welcome to the second in our health and safety webinar series. My name's Helen Bartle and I'm part of the capability building team at Creative New Zealand. It gives me great pleasure to introduce the topic today, the nuts and bolts. This webinar is going to help you to understand how to develop processes and systems for health and safety compliance and everyday working. It follows on from our first webinar where we looked at developing health and safety policies. And so now today we're going to look at the how you deliver on your health and safety policy. Our presenter this morning is Steve Lloyd of Coverage Solutions Limited, and today's session will last for an hour. There will be an opportunity for you to ask questions about midway through and also at the end. But if you have a question or a comment during Steve's presentation, just feel free to note it in the chat box on the left-hand side of your screen, and we'll answer that when we break. Both the recording of this webinar and the PowerPoint presentation will be made available via Creative New Zealand's YouTube channel for reference after today's session. So if you want to revisit any of the slides or any of the sections, you'll be able to do so. So I'll now hand over to Steve, and looking forward to getting stuck into today's topic. Steve, are you there?
Yeah, kia ora, ladies and gentlemen. Welcome to this morning's session. The last session we looked at, we took time to understand what the new legislation was going to be, what it meant to us as individuals, the elements within it, new terminology, officers, PCBUs, and more importantly, understanding what it is we must do now as a result of the legislation, and how we are going to do that is what we're going to talk about today. So essentially we're looking at frameworks today. So we're not really going to go into the detail of hazards and assessments and the likes of application of what we're going to talk about today. That's going to be the next seminar. So today I'm going to talk to you things about standards, processes, policies, procedures, and we're going to sort of get into a little bit more business 101, understanding how these sort of documents fit into our normal business life and into our businesses. So without further ado, the sad news, last year 49 people didn't go home from work. When we did our last session, we lost 43 individuals and unfortunately lost 6 more. And this is why we're doing what we're doing. We're having to understand why people are dying at work. Something wasn't in the place, something didn't work, the Swiss cheese scenario, all the little holes lined up that were in their paperwork, policies and procedures, and someone lost their life. It's not a pleasant statistic to dwell on, but I think it's important that we understand that people are getting hurt at work and people are dying in their work, and this is something that's not acceptable to anybody obviously. So consequently, we are here and we're trying to focus in on our sort of sector, the creative arts here in New Zealand, and understand what we can do differently. And we are a complex bunch of people. We've got complex relationships with suppliers, and it's a very interesting area when you start peeling back the onion layer and looking and understanding how we operate. So without further ado, the good news is today the framework elements we're going to talk about actually are a standard, and we have a New Zealand Australian standard here, ASNZS 4804. It's a document that outlines a framework, and it's essentially what I'm going to talk to, but I'm going to go a little bit deeper than the document does. And it allows us to understand the basic elements we're going to need in our documentation or in our health and safety management policies and plans. And also we're going to just have a look at some of the meanings and understandings relative to our creative businesses. The first document, and we mentioned in our last session, the first document that is critical is our health and safety policy. And we've got some key elements that must be within our health and safety policy. And the health and safety policy is just like any other business policy that we have, be that a quality policy, an environmental policy. It's got to have a mission statement. It's got to be integrated into and relevant to our organisations. It's got to reflect our vision, our core values and our beliefs. So there's no point in just taking a generic policy off the internet, inserting your business name here and saying we have a policy. You've actually got to sit down and have a bit of a discussion about this document and make sure that it's right and fit for purpose within your organisation. The other thing you've got to do is actually align it to your overall management system, so therefore your way of governance of your business. The health and safety policy shouldn't impact the way you do your business in terms of management. You have to make it fit and make sure it's work, and then you sort of work your way through all the other elements we'll talk about today, the activities, the products and the services that you're providing, and making sure the policy covers those. So in terms of your commitment, your integration and your relevance we've just basically talked about, it's got to be compliant, so therefore you have to express a commitment to legislative compliance, and that's normally from the top. So your health and safety policy is a document that's normally driven from the board. It's not driven from the workers up, it's driven from the board down, because it's got to show a commitment. And the commitment is to all the elements you need to deliver a health and safety outcome, such as resources and financial, and making sure that the board is part of the process rather than being dictatorial. They're actually a review, or in terms of the previous document, they're officers. They've got a due diligence obligation to them now, which is stated in the Act. And as a consequence of that, the framework helps them to get the information they need in order to make the decisions they need to make as a governing body. So that's sort of the commitment side. The compliance, obviously, you've got all sorts of legislation out there. Just off the top of my head, we've obviously got things like the Health and Safety at Work Act. We've got the Privacy Act. How do we deal with individuals' information? For instance, if someone has a particular medical condition, how do we actually manage the paperwork around that? Other issues are children. We also work a lot with children in our industry, and as a consequence of that, there's two acts that apply. There is I can't remember off the top of my head, but I'll make sure they're in the documentation that gets uploaded at the end. But how we manage children in our industry is critical, and ensuring that we don't impact on their learning capabilities. It's great if we find ourselves a child star, but if we are in a situation where are a young child actor, for instance, we have to make sure that what we do doesn't impact on their educational side and make sure we have a plan in place around that. So there's a lot of actual legislative compliance in the industry, and we may have our own internal company performance standards and our own company performance requirements that we have based on our other policies in our business. Accountability. Does our policy address things as the capacity to assign, delegate, deliver and review the actual commitments we're making? In other words, do we clearly have the ability to make people responsible and hold people accountable for the roles they play in our health and safety systems? Do we actually have a framework for setting objectives and targets? And what's our goals? Is it to minimise work-related injury and illness? How are we going to do that is something we'll work out as we move through today. But what we need to have is stated targets and objectives so that we can actually shoot for something. And I don't mean that in a literal sense, but we've got to have a goal and targets to aim for, because we're going to measure how we're performing against that during our processes, so that we can, using our processes, I should say, so that we can actually ensure that we're incrementally improving or continually improving against those targets and goals. Consultation is key. Our policy has to promote employers and their representatives, line managers, committees, contractors, subcontractors, suppliers, clients, independent experts. It's all about how we actually engage with these people, when we engage with them, what do we want from them, what are they going to need from us, and are we prepared to give that to them, and understanding how we actually work together across some pretty complex, someone's moving my slides for me. Moving across some pretty complex engagements here, all the way from venue owners way to equipment suppliers and making sure we're all working in harmonious. So we're just talking about the policy at the moment. And then one of the big things is prevention. The policy has got to adopt a prevention approach. So therefore, everything we do within our health and safety system is to prevent something. It's not there simply to pander to meeting a specific stated want. It's actually designed to prevent things. So there is in the documentation I'm supplying you guys, there is an example of a health and safety policy. Again, make sure if you want, and you're free to use it, but make sure that it fits your organisational relevance. So yeah, that's the policy, and that's kind of like the number one document in our framework, because the policy drives what we've got to build underneath it. So the policy is the stated commitment, and what we're going to do next is actually start to look at the framework elements that are going to deliver what we've committed to in the policy. So number one, planning. I'm going to be talking at you a little bit here around specific actions, and what I'm really talking about is documented procedures. So as I'm sort of talking through these numbered slides, what I'm really talking about is we should have a documented procedure that deals with these elements. If I look at the first one, hazard and risk, we should have a documented procedure for the implementation and the maintenance of hazard identification, risk assessment, implementation of controls, products and services for which we have control or influence over as a business, and also the activities, relevant relationships with contractors and suppliers that we have. So therefore, we should actually have stated procedures around all of those things. If we start going to and I'll focus on hazard and risk a little bit more later on in the slide deck, just sort of bringing up the key points here that we need to build a framework around. Obviously, we've got legal objectives, and we have to make sure we've got a process in place that allows us to access to all legal and other requirements to ensure they're up to date, and if something changes, that we're aware of those changes. And that's as simple as having signed up to WorkSafe's website and their legislation email, so they can send you auto updates. And so if something changes, you'll get updated. You then have a reflection on how that impacts your business. You can determine whether it's significant or insignificant. You can then, through the process that you've defined, take that to the team that it needs to be taken to, and work through how we actually get to the bottom of delivering outcomes in a legal fashion. I'm just reading the chat here, and I'm seeing that the slides don't seem to be working for some reason. So I'll just use titles here that help people. So under planning, we are planning a framework. We need to understand the processes around hazard and risk, our legal. I mentioned previously objectives and targets. We've got to have documented procedures for establishing objectives and targets, and then we get into measuring how we're performing against those objectives and targets. So typically, a broad objectives and targets, they're not overtly too specific. It may be initially it's to reduce to reduce the number of lost time incidents we may have in an organisation. It may be to reduce as a percentage the number of reported hazard non-compliance control type scenarios that occur. So from an objectives and targets point of view, it's normally site specific. They're normally focused on individual activities, and we've got to have a process of revision of objectives and targets and consultation with others. So therefore, again, objectives and targets within a business have to be relevant to that business and have to be relevant to that organisation. So I can't go telling you there is a one-stop shop for those. You have to have a bit of a discussion about it yourselves. It may be the number of man-hours that someone works in a given week, because we understand the fatigue and stress impacts. It may be the number of sick days that we have in an organisation. It may be, there's a myriad of sort of goals and targets and objectives you can put in place, but all it does is help you to put a stake in the ground and give you something to shoot at. The next sort of is performance indicators. So what we actually need to do, we actually need to have some performance indicators in our business, and by performance indicators, they're an indication of what's happening. And for instance, they should be outcome-based. They should be reflecting system or operational performance, such as the rate of injury, as I sort of mentioned previously, the number of sick days that we're having. We're actually measuring these things, and we're able to performance indicate will give us a trend over time. And when we're looking at trends over time, we're looking to see declines in certain things as opposed to rises. If we're seeing a rise in an area, that means that we're looking, seeing a rise is good because we're measuring something and we're seeing a change that's not in the right direction. That's an opportunity to have a look and understand what's going on and make changes in the business to solve a problem before it becomes worst case scenario. So performance indicators, they're normally input-based, e.g. the number of audits performed, number of inspections conducted, or percentage of jobs, descriptions made to include health and safety requirements. So these are things that we're putting into our health and safety framework, and it's something that we would normally review on an annualised basis. So we'd go back and have a look and make sure that those sort of performance indicators are relevant to our business, or we've achieved through the measurement of our performance indicators our objective and or our target. So we're going to have a look at a new one and put that in place. And then from a planning point of view, we want to have some health and safety management plans implemented and set out objectives and targets around designating responsibility for achievement of objectives and targets at relevant functions and levels of an organisation. So therefore what we're trying to do is make sure that we are holding people to account for the measurement of and the solving of problems of within the organisation. Now it shouldn't all roll down to a stage manager. Everyone needs to take their part and play their part in this organisation. And I suppose this documentation we're talking about, this framework, helps you understand where you fit into the organisation and helps define the responsibility and the role you're going to perform relative to health and safety, along with the other tasks that you have. Health and safety shouldn't be in a box off to the side. It should be something we expect to be able to do as part of our normal day roles. So when we're looking at management plans, we're outlining the means and the time frame to which objectives and targets are achieved. We're looking at our ongoing operations, specific health and safety issues in organisations. For instance, with a lot of the arts, travel is a specific health and safety scenario, rehearsals relative to fatigue and stress. There's a lot of high-level planning that needs to go into this, and the documentation that we're talking about, the framework, should drive this. Changes to products and services, so we may not do the same type of performance or the same type of deliverable in the same place or the same time. So therefore we may have things such as it might be dark instead of light, you might be working at height instead of on ground, you might be on a stage you might be on a portable stage as opposed to a fixed stage. So we just need to have management plans around what that all means to us as a business. And also if we have any significant changes in operating conditions, that may mean your board disbands or your organisation gets taken over or you merge with another organisation. We've got to understand what that all means to how we actually bolt together the bits and pieces in our framework to make sure that when something like that happens, we have a little process or a procedure around it. The next slide we're into is the implementation. So what we have now, we've done a bit of basic planning. We've got a bit of implementation to do now. So we've got to ensure our capability in terms of our organisation. We've got to ensure we've got resources. That looks at things like human resources, physical resources, and even financial resources. We shouldn't cut corners. Often with productions and shows, I see a lack of what I call stop-go moments. That is, we should, during a production, have a look at little stoplight moments where we're actually looking to go, do we carry on or do we stop at this point? Now that's not necessarily during our performance or during an outcome. This is actually pre that event. So therefore, if I use an example, if we're in an outdoor arena type environment and the weather is meant to be good but it is not, we expect it to come right but it isn't, we need to have some stop-go moments inserted so that we're actually able to deliver outcomes here. And they may have financial implications, so therefore we may have to refund tickets, all that sort of carry on. So we need to understand, not just from a health and safety point of view, but how this integrates with our other policies in our operation. So from a resources point of view, we've got to make sure we've got enough of them. We've got to allow and allocate adequate resources to be commensurate with the size and nature of our business. Again, this is the commitment from the policy, so therefore the board and the governing bodies of our organisations can't pull back at this point and go, oh no, you can't have any more people when we've identified that there is a need for a person from a health and safety perspective. It's it's counter to what they've committed to. So therefore, discussions must occur, and there's multiple ways of doing that. But there are some legal scenarios around how you can actually engage through the Act itself. It has a number of stated ways of engaging through your health and safety representatives, through your health and safety committees, one-on-ones and things like that. So therefore, there is mechanisms in place to resolve. We've got to make arrangements for the effective communication of health and safety information. That's not normally left to one person, and that's up and down the chain. We've got to make effective arrangements for the provision of specialist advice and services as required. And we've got to make effective arrangements for employee consultation and active involvement in the decision we're making. If we're looking at in terms of resources, that's just one element. So therefore, we should have processes and procedures around the type of resourcing we need, understanding the roles they play, the responsibilities they have, the accountabilities we're going to hold them to, and make sure we've actually documented how that's going to happen within our organisation. The next stage is integration. Management system elements that can benefit from integration. So we're just talking about our health and safety framework here, how we integrate it. We've got to have a look at our organisational policies, our resource allocations, our operational controls and our documentation. How does it impact those? Information support systems, training and development, organisational accountability structure, and to protect reward and appraisal systems. Again, that all rolls up into goals and targets and objectives of an organisation. So it starts to get a little bit complex as we look at those elements. Then we start looking at measuring, monitoring those systems to make sure someone's accountable for those, and communicating, reporting, making sure those elements are in play as well around accountability implementation. There's nothing worse than expecting a report and not getting it because someone didn't have the time or we didn't have enough resources to allow it to actually be created in the first place. So it's understanding how those sort of end-to-end processes happen and making sure that we're across those. Accountability and responsibility. It's normally personnel involved, so therefore we have to define, we've got to designate, document and communicate health and safety responsibilities and accountabilities. More importantly, authority to act and report relationships for all managers, supervisors, employees, contractors, subcontractors, and even visitors and the public. So we need to understand who's accountable for what and make it clear, don't make it grey. So therefore there's one person held accountable for an outcome. They understand they're held accountable. But in doing so, you've got to make sure that that individual is capable of delivering that as an outcome. And that rolls back up to the ensuring capability aspect. So therefore, from a resource point of view, you can't just delegate a role or voluntold, as often happens in our organisations. You get voluntold you're doing that particular outcome. Put your hand up if you don't feel comfortable doing that and advise, I don't think I've got the wits to be able to deliver this as an outcome. I don't have the training, I haven't got the experience. So you're not actually putting yourself in a position where you're exposing yourself because as a worker, you've got a responsibility to ensure that you don't do any harm to yourself or others as the first stated thing in the Act that you're responsible for. So if you don't believe you have the capability of ensuring that, then put your hand up and say, I don't think I can do this role, but with a little bit of training that I believe I can, and the training I need is X, Y, Z. So that's just accountability responsibility. So you've got to have a process in place that monitors and communicates any changes in designated responsibilities as well. And this could even flow through a production quite a lot. So during a build week or a bump-in week, certain people may hold responsibilities that then transfer once everyone's left. So there's got to be a process around who's responsible when. There's a production manager today, but on the running of the event, the production manager hands over to the stage manager. The stage manager has the following responsibilities. The stage manager has the power to stop-go, all those sort of things. We've got to document that because we're pointing to individuals' roles here and making sure that they understand what they're going to be doing within your organisation and making sure that we have the process to delegate. We have to make sure that we're able to respond in a timely and effective manner to changing or unusual circumstances during the events. So therefore, we've actually got to have a plan in place that sort of looks at all the elements that may or may not happen and who's responsible if that does. That's quite a wide-ranging statement, I realise. That could be anything from someone in the audience having a medical condition to a mechanical failure of a particular prop or piece of staging. So we need to actually have these things written down somewhat. Then we need to sort of have a look at the accountabilities within the scope of their responsibilities. I'm sort of doing double Dutch speak here, but hold accountability within scope of responsibility, employees at all levels for the health and safety performance and support of the overall management system. Accountability implementation, training and competency. We've got to have some procedures that should be developed around health and safety training. These procedures should take into account the characteristics and composition of the workforce, which impact on health and safety management. That's understand the people you're working for. A lot of our people are volunteers, so therefore any training that we do, we must incorporate the volunteers in that training. And we've got to understand as volunteers what their capabilities are in terms of comprehension around what we're trying to get across to them, and making sure again that they're capable. And having the ability to decipher if that is the case, whether individuals are competent and capable of performing the role that they want to do. Because volunteers are of heart, they're very good-natured people, they want to give their time, but you shouldn't compromise your production or your outcome or your performances using volunteers that aren't capable. All you're doing is increasing their overall health and safety risk across your business. I'm just seeing our slides are jumping ahead. Yep, I can see slide 7. I'm not sure if anyone else can. No slides visible. My understanding is that all my slides will be available at the end of this presentation through Creative New Zealand, along with all the other pieces of documentation that I'm talking about today. So unfortunately, if you can't see the slides, you have to listen to my voice. I'll try and not put you to sleep. That's my goal for the next sort of 20 minutes. I'm talking about training and competency now. Consultation, motivation, awareness. We've got to be involved in development, implementation, review of policies and procedures for hazard identification as a team. We can't do this as a one individual, so therefore we've got to do all these sort of things, consultation, motivation, awareness. We've got to have the whole business engaged in all elements of health and safety. It can't be dictatorial. Training and competency. I mentioned the characteristics and composition of the workforce. We've got to understand that. Responsibilities around hazards and risks, and who can't cope with what. Undertaking training appropriate to the identified needs. Training should be carried out by persons with appropriate knowledge. We've got to define our training program. Once we've identified the skills and the needs of our operation and organisation, we've got to align the correct training methodology. What other training notes have I got here? Employees are competent to handle the task. There's potentially existing training standards that exist in the industry that we could actually line against. I use first aid as an example here. There are first aid certificates. We've got to understand the level of first aid that we may or may not want to supply within our operations. And that may be, we may have suitable resources within our organisation who are suitably qualified up to level, let's say, level 3, 4 or 5 of first aid training. We may not need to pay St John's or a suitable organisation to come and ride shotgun at our events. Again, decisions that we need to make through our framework as to how do we account for that, and does something change in our organisation if someone becomes more comprehensively trained and is able to take on that role, again, to be discussed through the process. We need to make sure people have the ability to understand their job and their position within the operation, that they're able to analyse work tasks and have the tools to be able to analyse work tasks. They're able to analyse the results of inspections and audits, or be able to carry out an inspection and audit, and if they aren't competent to do that, don't empower them to do so. Reviewing of innocent reports, review of training effectiveness. Again, we're talking hierarchical type stuff here, but these elements should all be incorporated into your systems and processes, and you're identifying the people in your business who are responsible for those elements. Supplying goods and services. Now, I'm going to dwell on this one a little bit, and I'll probably circle back to this later on in our presentation. We should have procedures in place covering supply of goods and services, because effectively we are now introducing elements into our organisations, be it lighting, sound, staging. It might be even just hiring a courier driver and or a transport company. as a business now, we need to ensure that those organisations we're engaged with, those goods that we're supplying, being supplied with, or the services that we're being supplied with, actually align to that legislation as well. So you may want some sort of vetting process around supplying goods and the supply of goods and services to yourself. Now, if you're supplying goods and services, expect organisations who you're supplying to also want and demand certain things from you. Maybe they want your health and safety plan. They may want your health and safety plan around a specific performance. Venues, I know, are ramping up the requirement for you to have a plan around health and safety for the elements that you're in control of, and then they'll have a conversation with you around the table to talk about joint ownership of responsibilities and assigning the responsibilities to individuals from your organisation, their own organisations, so it's clear. So therefore, if something was to happen, that is important engagement. I call it the 3 Cs. We've got to cooperate, coordinate and consult around all the elements of health and safety of a particular performance or outcome. So, and I can't say this too much, it's actually a stated requirement within the Act. You've actually got to consult, you've actually got to coordinate, you've actually got to cooperate with each other, and you've got to document how you're going to do that. So therefore, if you've got a lighting supplier that's also doing your lighting operation, and you've got a sound supplier that's doing the sound operation at the same time, or you're doing you've got an art exhibition in a venue that's that you're managing, you've got to work with those particular elements as to who's responsible for what and where the lines of communication are and aren't going to be. So that's implementation elements. If I jump to my next slide, and let's all clap loudly if it worked for you. Measurement and evaluation. This is the next stage. So we actually, if we have all those processes and procedures in place, what we need to do is we need to make sure that we're actually doing what we said we're going to do, which is something very important in terms of the Health and Safety at Work Act. If we can't prove that we're doing what we said we're going to do, and we find ourselves in front of a judge, you will be found guilty. And unfortunately, in the courts today, I've followed a lot of the trials that have gone on around health and safety. It's not proven, you're not innocent until proven guilty. You actually have to prove your innocence, and the only way you can prove your innocence is through the documentation that you have. So therefore, you must be able to prove that you have done exactly what you said you were going to do. Some of the ways we do this is you do some inspection, testing and monitoring of your processes. So therefore, you may have you have what I call an action plan, which is a 12-monthly action plan that says you're going to review certain parts of your framework on a quarterly basis, 6-monthly basis, annual basis. So you record who did that review, what the outcomes were, any changes that were recommended, when they got implemented, and it's just a bit of a documentation trail that you're able to provide the court. Say, yes, sir, we did do this. Here's the proof that we did do this. Unfortunately, in this scenario, it appears that X, Y, Z occurred, and we didn't have that as in our procedures. So therefore, we will take that as feedback, and we'll implement that as a new procedure. That's typically what happens if you do have the ability to prove that you have a system in place. But again, just to reiterate, if something goes wrong and you find yourself in front of the courts, you've got to prove that you did what you said you were going to do, and that's what you said you were going to do in your policy and what you said you were going to do with this corresponding procedures in your health and safety plan and framework. So you've got to have a testing and monitoring regime. Audits are a good way of doing this. Audits allow you to drill down against procedures and to ensure that things are being done as they are meant to be done, and to determine whether it's rightly or wrongly being done. One of the best audits out there is to audit a control that's been put in place around a risk or a hazard that's been identified. For instance, you may have found a hole, so therefore you put up a barrier around that hole, a physical barrier, to remove, to provide a visual don't fall in the hole warning to somebody. That may be a perfectly good way for managing adults, but it might be a good way of managing children. So the audit may conclude that you're not able to provide a suitable barrier for children, so therefore if we find this type of thing in our environment, we have to put a bit more of a physical barrier up. Then we're having to have process and procedures around corrective and preventative actions. So therefore, we must understand, again, we've got to have a preventative approach to things, so therefore we should have toolbox meetings in the morning to understand what's changed on site today and make sure that we understand the implications of any changes and therefore put in place a preventative action as a result of that change so that no one is harmed. It may be raining and we're not going to use electrical cables today, as an example. And then we've got a process around incident investigation. So therefore, all the best will in the world, all the best processes and procedures, something is likely to happen. So therefore, we should have a process and procedure around how we investigate that particular incident. Typically, you would have a standard template and a standard process that you follow. So therefore, when you do an incident investigation, the outcome of that investigation has a level of consistency with it. I've got examples of incident investigation reports, and there are examples of templates in my documentation as well that you can apply to your organisation. So that's looking at the measurement evaluation. And then obviously we're about review and improvement. This is sort of more responsibility for the governance team, for the board. So they've got to review the framework, make sure it's fit for purpose. And our entire goal of the whole framework is continual improvement of our operations. So therefore, they've got to have the measurement thing in place through the audits and through the inspections and the testing that we're doing to ensure that we're continually improving our operations against our goals and targets. That's a board requirement. That's their due diligence requirement. So they may ask of you certain things around providing them with reports or providing them with some feedback or input around things that have gone on in the organisation. It's because they are legally required to do so from a due diligence point of view, so they can make the decisions to make sure that the budgets are aligned and that you have suitable resources to be able to do what you want to do. So that's basically the nuts and bolts of a framework. I'll kind of throw it open to some questions now. I'm just trying to see if I can see any questions that have come through.
We haven't actually had any direct questions, partly because we've been trying to catch up with the slides, Steve. But when we do the second half, we've got some questions at the end. We can obviously get to those. But there aren't any questions at the moment, unless anyone does have one. So I think we probably just continue on.
Follow on through. Right, what I'm going to do now is sort of dig a little deeper under the process and procedures framework and focus in on some of the key ones that you need to really think about now. This is sort of like the minimum that you would need as an organisation. And the first one I've got up here is hazard, risk, documented procedure. So what you need to understand is the process of hazard identification. So you need to obviously have within your organisation a procedure that allows you to identify hazards. And I mentioned previously a toolbox meeting. That's something that potentially happens in the morning. There are other elements such as safe working method statements, or a SWIM as it's known in the industry. A SWIM looks at the entire start to finish process that you're going to employ across, say, production. So how are you going to design something, how are you going to build something, how are you going to deliver it to site, how are you going to build it on site, how are you going to use it, all those sort of things. You're going to go through each of those elements as an organisation. You're going to pull that apart and you're going to go, are there any hazards associated with this that we need to manage? Now, you may identify a hazard. For instance, height. Height is a hazard, but that has, each hazard, I'm getting myself tied up here, each hazard that's identified could have multiple risks associated with it. So a single hazard, such as water on the floor, could be a slip hazard. It could be a corrosive hazard. It could be a drowning hazard. Or a risk. So therefore, you have to look at all the risks associated with that one identified hazard, and you've got to be able to do an assessment on it. And so you've got to have a procedure of assessment. How do we assess risk? Typically, you assess risk by looking at elements such as exposure to the risk, the consequence of that particular hazard if it was to become true. And there's actually a matrix that you apply to this, and I've got one coming up in a slide shortly that just shows you. I'll just have a quick run ahead. No, it's not there. I've got one coming up that shows you how you do a basic risk assessment. But again, identifying hazards and risk assessment is easier for those that have been in an organisational environment longer. But you also find people who have been ensconced in an organisation become a little bit basically they don't see the same things that others see. For instance, for myself to walk out on a beam, even though I'm attached with a harness, isn't a problem. For others, that may be an issue for somebody else. So the risk to me is low. The risk to a newbie doing that job is probably high because they don't understand the consequences if it all goes wrong. So you've got to have a process around risk assessment and have it written down as to how you assess risk. Then once you've assessed the risk, you have to work out what controls you're going to put in place to lower that risk. Because essentially a control, if we can't eliminate the risk or the hazard, we can't eliminate the hazard, and I'll come to the hierarchy of hazards elimination shortly. If you can't eliminate it or substitute it, then you're going to have to engineer your way around it. And that means you're actually going to put a physical control in, and that may be a barrier, or it may be a sign, or it may be a requirement to do something specific or not do something specific around a particular hazard. You've got to have a stated control around hazard and a risk. So you've assessed the risk, and a control simply lowers that risk. It doesn't eliminate that risk. So if you've got a high risk and you put a control in place, it probably makes it a medium risk. It's still a risk, but you need to understand it's still a medium risk. And in terms of once you've done your risk assessments across your business, you will be in a situation of being able to prioritise where you put your focus. And you normally focus on your highest risks first, then your medium, and then your lows. You're then moving into monitoring and the effectiveness of these controls. You should actually have processes around, if you put a control in place, we're going to go back and have a look at that control to make sure it's being effective in half an hour's time, an hour's time, to make sure that it's not actually, that it's doing the job that you thought it would do. And if it's not doing that job, then you put in an improved control and you record what that was, and you record that you made a change, and you did a corrective action, and this is what you did in this circumstance. As an example, a simple smartphone can take a photograph nowadays, so you can take a photograph of the effectiveness of a control and document that time and date stamp that it was working at that time, and then you go back in an hour and you can take another photograph, and you're just proving through that process of documentation that you're actually in control of your situation and that you're assessing its suitability. Products and services over which you have control, again, in a creative environment, all our supplier parties, you've got to be able to make sure that you've documented how you've assessed their suitability. You didn't go to Trade Me and just use Fred's audio services because Fred had some sound gear. You actually went to potentially a reputable company, and as a consequence of that, they've got health and safety processes. And you may find that their health and safety processes are better or worse than yours, so therefore you've got to do an alignment check and make sure that you're bringing them up to speed, or you're bringing yourself up to speed relative to what they need you to do for them in order to deliver a successful outcome. Relevant activities in relationship with contractors or suppliers. You've got to understand what they're going to do. That may sound simplistic, but if you've got a lighting guy, it's likely he's going to climb, or he's likely going to go out on the edge, or he's likely going to hang a light in a position where he's going to put himself at some risk in doing so, and he's got to secure it off. So, asking questions like, have you got a procedure about fitting off a light, and can you prove your competence in me? Can you prove to me that you're competent to do so? The first one, yes, you can be trained. The second one, proven competence, is something that I know the industry is working on with regards to qualifications around the technical side at the moment to try and get qualifications for our technical people that are recognised through NZQA. So that's something ongoing outside of this that I can introduce people to. So you've got to understand what they're actually going to do. Another good one is industrial hearing loss is a big one across New Zealand. So therefore, working with your sound guy to make sure that when he's sparking up his back line or he's doing a front of house check, that we've got minimum people in the area, so therefore we're not directly impacting individuals. And, firing up a bit of white noise when you weren't ready for it can startle some people who are doing something, and as a consequence of that, they may fall off something and hurt themselves. So just understanding what each individual is doing and the process they're doing it in, lining it all up and going, hey, we're going to do it in this fashion. That's why you have production managers who look at this sort of stuff. They look at when it's clear to do so, and if through the nature of events, there's going to be overlapping things going on at the same time, making sure we're communicating amongst ourselves what's going on. So that's just the hazard risk, and we're going to have a documented procedure. You've got to have a document of how you're going to do that, and it's a continual improvement thing. I've got some documents, as I say, that quite happy for you to have a look at. It comes from a venues perspective, but from a production environment, you may be able to adapt and adopt. I've got no problem with that. Again, one of the things we talked about earlier was ensuring capability, making sure the resources are integrated, the responsibilities are really understood. Nothing worse than two people looking at each other and going, I thought that was your job, and I thought that was your job. You need to understand from a health and safety perspective where things start and stop. So if you're making someone responsible for an audit, you've got to ensure they do that audit. If you're making someone responsible for checking the capability of individuals from a volunteer's perspective, you've got to have a process of, it might be just a simple check sheet. Have you done this before? Yes, no. Are you familiar with this? Yes, no. And then you determine what role they're going to perform as a result. Making someone accountable for that, they then provide you with a list, and bang, if something was to happen with one of your volunteers, you're able to say, well, look, we did assess them, and they were aware that they were responsible for X, Y, and Z because they signed here that they were accepting that responsibility. Bang, it then comes down to things like training. They might have said they had the training, but were they able to prove to you that they had that training? So this is just ensuring capability across your organisation. If you were to look at most of the unfortunate fatalities that happen, you'll find that the bulk of them lead to capability. Someone, that gun-ho New Zealand attitude of, she'll be right, I've seen someone do this, I'm pretty sure I can do that, and bang, it didn't line up like that. Or it's tough for some people to get a job, and as a consequence of that, we're finding that a lot of our lower skilled people are actually being killed on farms and in forestry type environments because they haven't been given the training, yet they will jump in and try and do something to prove their worth. And as organisations, we've got to recognise the keenness of individuals but hold them back until they're actually capable. And defining that capability is tricky at times because, as I say, as Kiwis, we don't want to be seen to not being participating in something, or we don't want to be seen not to help, but we've just got to make sure we do that in a measured way. So that's just the capability side of things. There's a lot of support actions we need to do, and it's got to be continual. So in terms of your framework, you've got to have a communication plan. So therefore, you've got to understand what you're communicating and when you're going to communicate it. And make sure there's communication lines available for people. So if someone finds a risk or a hazard that they're not confident on, or they haven't got it, they're able to push that up to the right individual. They know where to go. And then once it gets to that individual, they get to assess the importance of that, or whether they need to engage additional people to solve that. That's got to be a plan that's stated. Reporting is key. You've got to report the good and report the bad. At the moment, a lot of organisational health and safety plans is just about reporting negative things. So that's all about reporting lost time incidents, injuries, near misses. We should be reporting the good as well. For instance, if you've got a production going on, you should report the number of man-hours that were used during that pre, during and post that production. So you might have 10,000 man-hours, no incident. And if you do several productions and that's all of a sudden 70 to 100,000 man-hours worth of labour and effort you've put in for no incident, and then you have the one incident, you go up in front of a judge and go, well, here's our good record and this is the thing we did wrong, that will count. So reporting the good is something that I encourage across all creative processes, so that you're managing the outcome before it becomes an outcome through your reporting, if that makes sense. Documentation. You've got to document everything. So that's as simple as I say, don't kill your business through bureaucratic processes. Make sure that your documentation processes are fit for purpose. Templates and standard operating procedures are a wonderful way of cutting through that sort of writing a new document for everything you do something new. If you've got a template, reuse that template. Just make sure the template's fit for purpose and modify that template if it's not, but you'll then keep that as a standard template. Standard operating procedures, or SOPs, are something that a lot of you will come across if you're working with venues and or organisations. They are just a methodology or a way of working that's proven to be a safe and healthy way of working that the industry either aligns to or that particular production company aligns to, for instance. So therefore, having a SOP in place is something you review on an annualised basis or a 6-monthly basis to ensure it's still relevant. And the reason I say that is because the technology in our industry is evolving quite rapidly. So therefore, a SOP that we have today may not be relevant tomorrow because there's new technology or a new way of doing something, and we have to adapt and adopt. So documentation is key. Documentation control, I've alluded to it, through the use of an action list, which is something you build when you build your health and safety management framework. These are the things we're going to do during the year to make sure that our health and safety system is working, and document control is one of them. So therefore, you list all the documents that you're using in your organisation, and then you assess those documents on an ongoing basis for relevance to make sure that the current legislation is still current, that you're getting updates from WorkSafe, and that when a document comes in from WorkSafe, those communication lines are open, it gets pushed to the following people to make a determination if something else needs to occur. Records and information management. Again, it seems obvious, but you need to, as an organisation, understand where we're going to put this information, where we're going to record it, who's going to have access to it. Leaving it on a laptop's not a good idea. We tend to lose laptops, or laptops get broken quite a bit in our industry. So as a consequence of that, we may want to use the cloud as a base, but you have to think about it in terms of what information do we need to store, who needs the access. Do we put any sort of security on that to make sure that people can't mess with it or it gets lost? Dropbox is a very common methodology. You do have elements of control around Dropbox, and having a central repository for information is a good. You can point people to it as well. Hey, our SOPs are in this folder or in this location, and we can give you access to it as an example. You've got to have a process around records and information management. You can't just put it on a laptop. It just doesn't work like that. Or works like that for a very short space of time until something goes wrong, and then it's all hell breaks loose. Risk assessment. This is something I talked about previously. One of the key things here is there's normally multiple risks around a hazard. You use a risk matrix to develop a risk rating, deal with the highest risks first. There's a hierarchy of control. You should try and eliminate first, and if you can't eliminate, substitute. For instance, if you're using a toxic chemical, use a non-toxic chemical. That's a good way of solving that. If you can't do one or two, then 3 engineering controls. That's barriers, that's signage, that's acoustic panelling, all that sort of stuff. You use engineering controls to solve problems. Then you get administrative controls or procedures, and then last line of defence is personal protective equipment. So whenever you're doing a risk assessment, you have to ask those questions. Can we eliminate this? Yes, no. Can we substitute? Yes, no. Are there engineering controls we can put in place? Can we engineer this pump? It's too noisy, or this particular element. No. Can we put a procedure in place? Yes, we can call it a SOP. Great. And then we're going to have some PPE as a follow-up. So that's risk assessment. I'm starting to speak because I'm running out of time. This is what a risk matrix looks at. It looks at the severity of a hazard. So therefore, if this hazard was to become true, is it catastrophic, significant, moderate, low, or negligible severity? Then you look at the likelihood of it. It's improbable, it's a remote chance of it happening, it'll happen occasionally, it's probable, and it's frequently going to happen from a likelihood. So if you've got likelihood and severity, you're going to have that sort of green to red sort of matrix. And if you apply this to your hazards, you say, well, that's a 4 and that's a 3, so therefore you call that's a yellow. I should perhaps, it's an undesirable action, so I'm going to have to put a control around that. And obviously, if it's a red, you're going to have to deal with it big time. If it's a green, you typically have to monitor it to make sure that its condition isn't changing. In our industry, design, fabrication, install, and commissioning is important. We need to understand when you're designing something for, be it a piece of art or be it an installation, be it a production element, you need to make sure that you're not introducing risk as a result of that design. You have to understand how you're fabricating it, making sure it can be fabricated in a way that it's not going to introduce risk. You have to install it in a way that it have to be designed to be installed without introducing risk. When you commission it and when you tear it down. So you just have to understand all those sort of elements as you build your if you're designing and fabricating something, and that's the same for any industry. That's actually building and designing something. You actually need to make sure that every step of the way you're applying a health and safety view around, are we introducing risk every time we make this change or do this particular action. Purchasing goods and services we've discussed. One of the things there, financial security of the organisation you're buying from. You want to make sure that they can uphold their end of an agreement should it all go pear-shaped. The 3 Cs, consult, cooperate, coordinate. Contingency preparedness. You've got to do your disaster planning nowadays. You've got to also understand how you're going to manage things in incidents that involve employees. You've got to have a critical incident recovery plan. So that's not just the first hour after the event. That could be days after the event. If you're travelling and a massive something and something happens, how are you going to look after your people? How are you going to get them home? Are you going to get them home? Are you going to stay in the same place? What aspects do we need to understand around the situation we're in? Do we have accommodation? Don't we have accommodation? What do we do if we don't? So you actually should have some forethought around that before you actually go and embarking on those endeavours, because 9 out of 10, something will happen and you won't be ready for it, or you will not have talked through this is what typically happens. Just a word of advice from me is what typically happens in those incidents is those with family members with children will want to get home. So therefore, don't go giving the responsibility for coordinating something to an individual who wants to get home to be with their kids. Understand who's available to do what in your environment. Audits, we've talked about audits. Audit frequencies, the results, and determining needs. Corrective, preventive actions. Oops, editing there. Just got to make sure that we are doing what we can do in terms of corrective actions if something does go wrong, but our prime goal is to prevent something from happening in the first place. And incident investigations, we talked about it. Important, all of the incident investigations are in a no-blame environment. So no one's at fault. We're just trying to understand what broke down, the process or the procedure. We just want to understand what broke down so we can fix it. Reviews and continual improvement. Again, document everything. Root cause analysis is a specific skill, something that someone in your organisation should have as a skill, because it helps them to determine what the root problem was and how to solve that problem is something that then the business can determine. The risk game, make sure you don't roll the dice. And we're into final questions and answers with three minutes to go. Does anyone have any questions?
It seems to be reasonably quiet today, Steve. I don't know if anyone does have a question, but if not, then we can always pass on any questions after the session today if you think of something at a later date. Just to say, Steve, thank you so much for the webinar today, and thank you for providing us with fantastic insights.
No,
we do have the work. Oh, we've got a question. Great.
Yeah.
So Jess Smith, she's from Silo, and she's wanting, Suzanne Smith is asking, are there any
formats for government policies?
Governance policies.
So that was Suzanne Smith. Suzanne, as I suggested at the beginning of this, there is ASNZS 4804 is the health and safety governance policy. Governance standard. So we're really talking about standards here. And if you were to look at ISO type standards for government policies, there's a myriad of them out there. So if you're looking for organisational structures, board governance, directorships, there's a lot of standards that are applied. Rather than look for policies, look for standards. You'll find if you just Google up some standards around governance, you'll find that there's actually quite a few of them out there, easy to access. Casual workforce, labour, managing those guys and girls from a casual point of view, they're workers just like anybody else. If you're a PCBU and they're casual workforce, labour, you've got to manage them. So therefore, if it was me, they're your greatest risk because they're not entrenched in your organisational operations on a daily basis. So therefore, they're least understanding of what's happened in the last week, last month. They're coming in with only a snapshot of an understanding. So the casual workforce and your labour force needs your greatest hand-holding at any given point. And you need to have some procedures and policies about how you're going to do that, how you're going to communicate with them the latest, how you're going to communicate the expectations to them or what you're expecting of them, and how you're actually going to get them to sign up to accepting that responsibility, because they have to accept the way of working within your organisation. Rachel, those last two slides are all quite fast. Can we do those again sometime? Well, they'll be available to you post this little webinar. So absolutely, we're on the CNSI website. Will these be available? So that's something for you to organise there, Helen. you'll send that out, I'm sure.
Yes, and I should also say we do have a third and final webinar on health and safety. So date for your diary is the 16th of May, same time, 10:30 to 11:30, and we'll be looking at working smarter and safer. So I'm sure there'll be crossover between some of the areas you've covered today and the final webinar, so that will be really good.
Yeah, correct.
And
So
we'll
what
send details nearer the time.
Yeah, so what I'll be doing in the next webinar is actually pulling out all the things that I'm aware of in our industries and going through them in detail, just like we've highlighted there. So contractors, managing fatigue is a biggie? Yes, it is. So therefore, I've got procedures around how we do that, and I'm able to demonstrate that in our next webinar.
Great, fantastic. Well, we're just at time, so I think we should wrap it there. But just to say many thanks again, Steve, and thank you to all of you for just bearing with us while we sorted out the slide issue, and special thanks to Richard at Footnote for helping us all recover the slides and get back on track. We do have another webinar coming up on online marketing on Tuesday the 28th of February. We'll be looking at whether online marketing is measuring up, and please complete this survey for us to be able to measure the impact of today's session. That would be much appreciated. Thank you for joining us, and we look forward to seeing you all again very soon. Thank you. Ka kite.